30 million people in the United States undergo some form of medical treatment that requires anesthesia each year.
And since surgery can play such an important role in life, you want to go through it successfully. And that's why we have Chris Hulin from the Middle Tennessee School of Anesthesia here with some questions that you should ask before you go under. This is really important. And you know, Chris, we were just talking about this. Why is it so important that you can't eat or drink anything before you go into surgery? That's always the thing. They tell you, don't eat or drink anything overnight. Why is that so important?
Well, the concern we have as anesthesia providers is once we put you off to sleep, muscles obviously relax, and we don't want anything in your stomach to come up into your mouth and then fall back into your lungs and cause pneumonia, complication we call aspiration. And so we have a concern about that.
Yeah,
so that's why the no food thing.
It is kind of a concern when people are going under. Anytime that you go under anesthesia, you have to take it seriously. It's nothing to be taken lightly. What are some of the questions people really need to be asking before they go under?
Well, one of the important things that we ask in a preoperative interview is that the current medications that they're on. We really need to understand the medications that the patient's taking, specifically medications for diabetes, heart problems, high blood pressure, so that they don't interact and we kind of get an idea of how to plan that anesthetic to be as safe as possible, and it gives us an idea of their current health condition as well. Asthma is another thing that we really try to search out. It's always a good idea to bring the medications the day of surgery with you, or a very detailed list, because we know that they change a lot for patients.
Now, is there a difference? I would assume difference in dosage of the medication that's given, but as far as age goes, like young children all the way up to adults, is there concerns that people should have if their children are going to be going under?
Just getting a good health history. There's no specific concerns relating to children. They're at risk for some different types of complications, but we're well prepared to handle those. A good detailed history is the most important thing, and we can, again, provide that anesthetic as safely as possible.
Tell us more about your school, because two of my friends have actually graduated from there. They're now CRNAs, and I know that that's nurse anesthetists, right?
Correct.
So when people go through the school, tell us more about it and what happens after.
Well, the admission requirement to the school is that you need to be a registered nurse with some critical care experience. We're looking for some of the brightest and the best in the nursing field. And it's a 28-month program, very intense, a lot of clinical training. MTSA, this is our 60th year in business. We have one of the probably more intense clinical programs. We call it a front-loaded program, or a non-front-loaded program. Our students are out there within a couple months of enrolling school, starting to get their feet wet, and so they have a couple years of very good anesthetic experience, and they come out being prepared to take on just about anything in the anesthesia world. I mean, they were well prepared. Pretty
high demand too for CRNAs. I mean, they can travel just about anywhere now.
There is a high demand throughout the country, and certainly there's plenty of opportunities for them to specialize and do different things.
Now, do you think that anesthesia in general gets a bad rap as far as the people who are nervous about things that they shouldn't be nervous about and things like that? You know, because there's risks associated with any medical procedure, but it seems like anesthesia gets a lot of, like, some nerves that may not be warranted.
Well, and a bad rap, not necessarily, but certainly there's a lot of fear. I mean, we are taking patients to a point, you know, a very controlled environment, but putting them to sleep, there's always concerns. Patients come in, oh, am I going to wake up? It's extremely safe. I want to let everybody know that. Anesthesia today, I took a far more risk driving off the ridge in Portland coming in here than going under an anesthetic. I mean, statistically, it is very safe. Again, just getting that relationship with your healthcare provider, communicating the concerns you have, and getting that level of comfort is probably the best thing to increase a good outcome.
And ask the questions beforehand.
Definitely. If you have questions, you've got to lay them out there. The worst thing is taking a patient back to surgery who has these things running through their head. They're nervous. Getting it out there and getting a level of comfort will certainly smooth the whole experience out.
I'm sure you've heard it all anyways. I mean, you're prepared for any questions that may come your way, but then at least they can be in that position comfortably.
Absolutely.
Yeah,
and anytime you have a pregnant lady, you're a hero. So that's all I'm going to say. I love my CRNA when I have my baby. All right, for more information on the Middle Tennessee School of Anesthesia, you can visit them at mtsa.edu. Chris, thanks for coming in.
Great to see you.
Good to see you.
Thank you for having me.